Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. Here today with everyone to provide an update on the COVID-19 situation across the state for today, Tuesday, May 5th, 2020. And today's update begins on a sad and somber note. The Maine CDC is reporting that 4 individuals with COVID-19 have sadly passed away. One was a man in his 70s from Kennebec County. Another was a woman also in her 70s and also from Kennebec County. The third was a man in his 70s from Cumberland County. And the fourth was a man in his 80s, also from Cumberland County. These deaths bring the total number of individuals in Maine who have passed away now to 61. And it is yet another reminder that on a day when there have cumulatively been now over almost 70,000 cases of coronavirus across the state that have resulted in people passing away. This is a reminder that each and every one of these numbers has a name and that every case counts. As always, we, all of us at the state of Maine, offer our condolences to the family members of these 4 individuals, as well as all the individuals across the state of Maine who have lost their loved ones during this time of COVID-19. Overall, Maine CDC is reporting now 1,226 cases of coronavirus, an increase of 21 cases since yesterday. Of those cases, 1,150 are confirmed, an increase of 14, and 76 are probable, an increase of 7. As we'll talk about in a moment, these case tallies do not include the recent results that we've received from the Tyson poultry processing plant in Portland. Overall, there have been 187 individuals who have been hospitalized with COVID-19. And as I noted a moment ago, 61 individuals who have passed away. Overall, there have been 741 individuals who have recovered. And of those 1,226 total cases, 269 have been among healthcare workers. In a moment, I'm going to talk about some of the outbreaks that we're monitoring, but I also would like to ask everyone to keep in mind as we talk about these outbreaks in these long-term care facilities, please bear in mind that these outbreaks are very challenging and that as we discuss each of these numbers in each of these facilities, please know that Maine CDC staff are working tirelessly with the staff, the individuals who work at these facilities, to keep each and every one of these residents safe. So with that in mind, I'd like to just go through the latest numbers on where things stand at a facility-by-facility level with the various outbreaks that we've been working on at long-term care facilities. This is pursuant to a request from one of our colleagues in the media. So to start with, at the Augusta Center for Health and Rehabilitation, there are 48 residents and 28 staff who have been confirmed as positive, for a total of 76 cases. Sadly, there have been 7 deaths affiliated with the Augusta Rehab Facility. At the Edgewood Rehab Facility, there have been 10 residents and 5 staff for a total of 15 cases and 1 individual who has passed away. At Falmouth by the Sea, there have been 29 residents and 16 staff for a total of 45 cases. And sadly, there have been 2 individuals who have passed away. At the Maine Veterans Home in Scarborough, there have been 32 cases among residents, 23 cases among staff, and sadly, 12 individuals who have passed away. At the Tall Pines facility in Waldo County, there have been 32 residents who have tested positive and 11 staff members, and there too, there have been 12 individuals who have passed away. And finally, at the Cedars in Portland, There have been 10 residents, 5 staff members, and 1 individual who has passed away. I'd like to turn now to the work that we've been doing and the conversations we've had with our colleagues at the Tyson Poultry Processing Plant in Portland. Yesterday, I mentioned that as we were walking into this briefing, we received word of 5 positive cases among the first batch of test results that we had received. We have, subsequent to that, received an additional 20 positive results as well, bringing the total number of new cases at the Tyson facility to 25. This is on top of 12 cases that there were previously. Thus, the total number of cases that have thus far been diagnosed at the Tyson facility stands at 37. But one important numerical note, the 5 cases from yesterday and the 20 cases that we just got word of are not yet reflected in Maine CDC's case totals. We are waiting for each and every one of the results to come in before we officially add them to our case totals, just so we can make sure we keep track of every single person who was tested. So again, to run through those numbers again at the Tyson facility, before universal testing started, Maine CDC was aware of 12 cases. Yesterday, we received word of 5 cases from the first batch. And just a little while ago, we received word of an additional 20 cases, bringing the total number of new cases to 25, and the total number in aggregate overall to 37. Those 25 new cases will be included in tomorrow's official case count. Again, those 25 new cases will be in tomorrow's case count. Maine CDC teams of epidemiologists, medical staff, and environmental health experts continue to work very closely with our colleagues at the Tyson processing facility. Because a few results are still outstanding, the Tyson management and operators have decided, in fact, to idle the facility for a few more days, just to make sure that each and every result is back and that the epidemiologists at Maine CDC have had sufficient time to make contact with cases and provide the facility with the most up-to-date and most current epidemiological and public health advice. We continue to work very closely with them and will continue to do so as additional results come in. Finally, I'd just like to provide a quick update on some of the work that our public health emergency preparedness team is doing, specifically on the PPE front. First, a quick update on the fit testing progress that we've had, working in concert with our colleagues at the National Guard. At the Kennebec Center, yesterday, our colleagues at the National Guard fit tested 31 staff members, and today are finishing that out by fit testing an additional 29. Today, following that out by fit testing an additional 39 staff members today, for a grand total of 70 individuals who will have been fit tested. Another group of men and women from the National Guard are also on site working with our colleagues at the First Atlantic Homes organization to fit test staff there so that they too can take advantage of N95 masks. Overall, as I noted yesterday, 67 orders for PPE were filled, comprising over 47,000 pieces of PPE that went out the door just yesterday alone. This PPE generally goes toward congregate care settings like nursing homes, as well as to our first frontline responders, such as locally based fire, rescue, EMS, and law enforcement individuals. We plan to continue that work today, and in fact, 60 orders are in the queue that are going out today, working in concert with our colleagues at the Department of Transportation. We also received the first batch of swabs from FEMA. I noted last week that starting this week and every week for the next several weeks, Maine CDC would be receiving 4,000 cotton swabs from FEMA to aid us in our work, especially as we move more and more toward mass testing at specific sites. And so we have received the first batch of those 4,000 swabs. And finally, I'd just like to provide a quick update on where we are on various vital medical resources. Overall, right now in Maine, there are 36 individuals who are hospitalized with COVID-19. 18 of those individuals is in an ICU bed, and 12 of those individuals is on a mechanical ventilator. In total, there are 319 ICU beds across the state, 157 of which are available. There are 318 conventional ventilators across the state, 293 of which are available, and there remain available 395 alternative ventilators. So with that, I will turn things over to our colleagues in the media, and today we will start the questions with Kevin Miller from the Portland Press-Herald. Go ahead, Kevin.
Hi, Dr. Shaw. Thanks very much. First, two questions. The first one about Tyson. Can you tell me what percentage of the 400 plus employees have you gotten the test results for? And just kind of give an update on how the contact tracing is going that we talked about yesterday, given the challenges with that community.
Sure thing, Kevin. So right now, per a call that we just had at 1 o'clock with our colleagues at Tyson, the results that have come back have been on all of the full-time team members at Tyson. So each and every full-time employee at Tyson was offered a test, and I believe that number was 391. But Tyson also opted to offer a test to each and every contractor or outside individual who had been in the facility as well. And that's the batch of remaining tests that are still outstanding. I believe that number is approximately 30 tests that we anticipate receiving today or tomorrow morning. In terms of the contact tracing, now that we've gotten the first batch of positive results back yesterday and today, our team of field epidemiologists is starting that process. They started yesterday afternoon and have been continuing through the day, reaching out to each and every one of the positive cases. And so that's where things stand. The playbook there that we follow is the playbook that we follow in any situation where there's a positive case, which is to say reaching out to individuals if they're positive, making sure that they have what they need where they are to try to ensure a safe recovery, as well as trying to get a sense of others that they may live with to try to provide them with good public health advice to prevent follow-on chains of transmission. So that contact tracing is underway right now. We anticipate that it will go on for quite some time as we identify more contacts and more close contacts of contacts, and then another ring thereafter. It will probably go on for quite some time, but candidly, that is what our team of field epidemiologists does day in and day out. As we discover more cases and as we discover the potential for subsequent cases resulting from these initial ones, we'll make sure we keep everyone posted. We will turn next over to Charlie over at the BDN.
Yes, hi, Dr. Shaw. I have one question about Tyson and then another about long-term care facilities. I'll start with the one on Tyson, which is I understand some of the workers there are immigrants, and you kind of touched on this in the last question, but I'm curious what Maine CDC is doing to make sure that their families are not, that outbreaks are not happening in the households of those workers, and that their families are kind of safe from the infection themselves.
So Charlie's first question is in recognition of the fact that many of the individuals who work at Tyson may be from immigrant communities. And how are we taking special steps to reach out to them in order to be especially solicitous and try to prevent transmission within the home? And the answer, Charlie, is that we're doing a few things. The first is, of course, in recognition that there may be individuals for whom English is not the first language. We're trying to make sure that we've got an array of medically certified translators who are ready to help us make sure we can communicate clearly and accurately with folks. These conversations are difficult enough and technical enough, but when you add on an additional layer of someone for whom English may not be their first language, words like quarantine and coronavirus may not translate so well. That's why we make sure we use certified medical translators for that work, not just someone we happen to know who might speak the language. But the other thing, Charlie, that we're thinking about in any situation like this, not just specific to Tyson, is making sure we think about those for whom cases might live with. Close contacts, household contacts. And there, in this situation, we want to be especially concerned, given that immigrants are often disproportionately affected, as we've talked about, with these types of situations, and potentially at higher risk for discrimination. We're also making sure we ask about other things that might be going on. For example, making sure we ask whether they've got safe, stable housing. Because if they don't, that's a problem not just for them, but certainly something we want to think about as a public health system as well. So we are trying to take those factors into play as we go about our contact tracing. And Charlie, you mentioned you had another question as well?
Yes, thanks. In a recent interview with one of my colleagues, I think you had mentioned that the hope is for Maine eventually to loosen the COVID-19 testing criteria in long-term care facilities. So I'm wondering if, A, when that could happen, if you know, and B, if you think some of the outbreaks we've seen could have been prevented if the state did have wider testing, kind of preemptive testing in place earlier.
So Charlie asks about when we might be able to move toward more widespread testing, specifically in long-term care facilities. And Charlie, you're right. We would like to be able to test more widely. And I think there's 49 other state health directors who, if they were here next to me, would say the same thing. They would like to be able to test more widely and specifically within long-term care facilities in their state. In order to do that, we need to make sure we have sufficient supplies on hand to test not only those individuals in long-term care facilities, but also the staff, as well as maintaining our current testing for, say, hospitalized individuals or first responders who need to know whether they're negative or positive so they can get back to work. So in light of that, what we are working very diligently on trying to expand our overall testing supply, which will be the real kingpin that's necessary before we can move toward more expanded testing. Now, Charlie, you ask a sort of a counterfactual question of whether any of these outbreaks may have been prevented. It's very difficult to know that. Very, very difficult to know that. Preventing an outbreak, preventing the introduction of something that is as transmissible as coronavirus into a population where folks are medically vulnerable is very difficult to do. Even with universal testing, that testing would need to occur once or twice a day even in order to detect somebody who had just become positive. So it's difficult to prevent outbreaks from that score. What we know about infection control is that testing is necessary, but the real magic, the real art of infection control is the tried and true things like hand washing, like PPE, like good universal infection control practices that healthcare workers across the state are skilled in already. We're going to turn next to Michael Fern over at the Maine Edge.
Thank you, Dr. Shaw. I have two questions today. My first revolves around a question posed by several healthcare providers regarding delaying reopening businesses. Since we are delaying some businesses reopening until June and even more until July, this means we're also pushing the eventual wave or spike, if you will, of cases further into late summer and more likely into the fall when flu season kicks back in near week 40. Do we risk more deaths in delaying the wave with those who may contract both COVID-19 and the flu and overwhelming the healthcare system? And my second is about access to affordable healthcare. With more employers announcing their permanent closure the past few days and therefore also their employees losing their health insurance, is it concerning that we risk greater public health harm as people lose access to affordable health care? Mm-hmm. Thanks.
Thanks, Michael. So your first question is around the potential that we could be just delaying the inevitable. I'm putting some words in your mouth there, Michael, but the idea there is that any spike of cases that we might have, we're just delaying it and potentially pushing it off to a time when it might be coincident with the flu virus, for example. It's a fair concern. we really don't know what any type of resurgence of coronavirus might look like, if there even is one in the first instance. And if there is a resurgence of coronavirus, how big that spike might be. A lot of that depends on how much we drive down transmission right now. One of the driving factors of coronavirus is how many people there are out there who've got it. It shouldn't shock anybody to know that where there are more cases of coronavirus, there will be more cases of coronavirus. If you compare Maine to Massachusetts, for example, that's because each case can generate more cases. So if we really tamp down on coronavirus right now, there's better odds that we will reduce the risk of any subsequent spike, or alternately, if that subsequent spike does recur, have it be as muted as possible. Now, could that be at the same time as, say, the uptick in flu? That is possible. It is possible. But what we also hope is that at that time, whatever time that may be in the future, we'll have further and more tools in our belt. We might have FDA-approved medications at that point. Depending on when it is, it's theoretically possible that there could be a vaccine. There is more time to build up the resources in the healthcare system from an assets perspective as well as from a treatment perspective. And that's what the activities right now are designed to do. Now, you also ask about healthcare coverage, and that remains a concern. It certainly does. There are provisions in place to prevent individuals from becoming uncovered. We can get you more information about those, Michael, and perhaps put you in touch with our colleagues over at Maine Care as well as at the Bureau of Insurance to get more information on that. But please know that that is certainly a concern, and it's one of the many factors that we have to balance.
Dr. Can I ask a follow-up?
Sure.
On Friday, there were 21 cases at the Hope House in Bangor, and I think it was 20 reported yesterday. Was there one reclassified? And what's that number today?
The number remains at 20. And let me just go check here. Yep, the number remains at 20, 16 residents and 4 staff. And I believe there was a reclassification of one of the cases. We will turn now to Steve Missler over at Maine Public.
Thanks, Dr. Shaw. You may have seen some of the press coverage about Jackson Labs ramping up testing in Connecticut at its campus there. Dr. Liu, we just spoke with him on Maine Calling a few minutes ago, and he said that that kind of testing ramp up could be possible for Maine, but that nobody's asked Jackson Labs to actually perform that task. Is that your understanding as well? And if so, how come we haven't asked them to help us with this testing issue?
So Steve asks about the work that our colleagues at the Jackson Lab have been undertaking. And Steve, we've actually had numerous conversations with the Jackson Labs. I myself had a conversation, have had numerous conversations with them as recently as 2 Saturdays ago. I had a call with Dr. Liu himself to talk about the work that they're doing. And he did indicate to me that they are ramping up testing at their facility in Connecticut. He indicated that it would be online sometime in June. We're looking for solutions right now. Steve, you and I have talked about deals that we're trying to get done in the very, very near future that would allow Maine to ramp up its testing capacity right now. But we're in a situation where we need as many actors as possible at the table with us. And so we've continued to work with our colleagues at Jackson Laboratories to make sure that when they are fully up and running and able to do those 20,000 tests a day, we'll have a system in place. What we need to have, however, before we can go too far down any testing pathway, is that we need to have a system that can take those samples, transport them to where they need to be tested, report the results back out to us quickly. Right now, our focus is being able to do that at our laboratory in Augusta, because providers know that process. But certainly, as we go into the testing discussions more deeply, we will need as much capacity as possible, and we absolutely welcome our colleagues at Jackson Labs to the table. Again, I've had personal conversations with Dr. Liu to talk about what we need, not so much in June, but what we need right now today. And so we're going to continue talking with them. And once they're up and ready to go, we'll be ready to continue working with them.
May I follow up real quick?
Sure.
Yeah, I guess just I want to clarify. Is it sounds like it's a timing issue. You need testing sooner rather than later, not June. And it sounds like there might be a logistical issue here too in terms of getting the tests to the Maine state lab. I just want to make sure I understand you correctly.
Yeah, so it's partly about making sure that, right now what we're looking at is needing to scale up our testing in Maine as soon as possible. I've referenced at these meetings to a lot of folks, and Steve talked to you and some of your colleagues about a deal that we've been working on that would allow us to ramp up quite significantly very quickly. So it is partly about the timing, but also as part of any such situation, one of the questions that I always have is making sure that any type of testing is something that's logistically easy for healthcare providers. Healthcare providers are used to the way that Quest and LabCorp work. They're used to the way that the Maine State Laboratory here in Augusta works. And I would want to make sure we replicated that easy button type approach with any new provider that we're offering tests. So again, we are delighted that a Maine organization like the Jackson Laboratories is ramping up their testing. We look forward to working with them. Don't get me wrong, very much want to work with them because we will need all the capacity we can get. We've also just got to do so in a manner that makes sure that providers, who are really the ones ordering the testing, that providers know how to use that, and it's in a way that their workflow can accommodate. Does that answer your question, Steve?
It does. Thank you.
You got it. I will turn now to Amy Brown over at WERU.
Thank you, Dr. Shaw. I have a question about just sort of following up on the tracking of people who have tested positive, if they are quarantining and returning to work. I know the public health people are in touch with folks who have tested positive, and I assume also who are presumptively positive. If those folks were to refuse to quarantine for whatever reason for those 2 weeks, would you be aware of it? How would that be handled? Are there employers notified if they are in a job where they could be going back to a job too quickly?
So Amy asks about some of the details that underlie what happens when we inform somebody that they've been exposed and how we work with them to manage the quarantine process. And Amy, we do a couple of things there. We ask them if they have notified their employer, and if not, we take it upon ourselves to do so. We also give them strict criteria for what quarantine means, what it means to really stay inside, what it means to make sure they're avoiding contact with others. But the key of all of that is that we check in with them. We check in with them to see how they're doing, to see if they've developed any of the symptoms of COVID-19. And if they have, we make sure that they can get care. If an individual indicates that he or she is not going to abide the rules around quarantine, we try to have a frank conversation with them. We try to tell them that they've been exposed, they could potentially get sick, and if so, they could pass it on to others. And in every single instance thus far with coronavirus in Maine, individuals have been willing to cooperate. And that's a sign. That's a sign that when difficult situations arise, every single person in Maine that Maine CDC has spoken with has been willing to say, you know what, I'm going to do my part to the spread of this disease and make sure I keep everyone around me safe. I am going to turn, yep.
Sorry, could I ask a follow-up question?
Sure.
About the probable cases, are they people who just have I know that you defined the other day that they are living with someone or in close proximity with someone who was tested positive. They've talked to a healthcare provider. They have the symptoms. Will those folks eventually be tested and be moved into the confirmed tally?
So if an individual, so Amy asks about individuals in the probable category. And Amy, if one of those individuals decides to get tested, or rather if their doctor decides that they should be tested, and they come back as positive, then they would be moved into the confirmed category. If their doctor decides that, clinically speaking, the doctor's got enough information to go on to feel safe that it is coronavirus, then then their status remains as probable. It really is ultimately up to the doctor to order the test to have them tested. Maine CDC doesn't manage their health care or their medical care. That's fundamentally up to their doctor. I am going to turn now over to Don Kerrigan over at News Center. Hey, Don, you with us?
Okay, finally. Sorry, I was muted. My apologies. Can you hear me all right?
Yep, sure enough, Don. Go ahead.
Good. Thank you. I have a question about the Hope House and then two questions related to testing. The question about the Hope House is, where are the 20 people who have tested positive there at the Hope House? Where are they being housed? Are they being quarantined at the Hope House? Are they being quarantined at some other facility? And how is that all being managed? Maybe you want to answer that first before I ask the two testing questions.
Yep. So Don asks about the individuals at the Hope House, and of the 16 residents who have tested positive, where are they? And Don, so in working with the management of the Hope House, city officials, there have been plans in place to accommodate those individuals. We'll be able to get you some more information about them, but the approach in congregate settings, generally speaking, is to make sure that any individual who tests positive is no longer at that facility, but is also provided with safe housing during their period of isolation during coronavirus. So we'll get you some of the details about that, Don, but that's a concern that we thought through and we're aware of because we knew that would happen early on. It's all well and good to think about universal testing, but you always have to think about what you do when you identify someone who's positive and how to plan for that eventuality. And so that's what we've done, working with city officials in Bangor, as well as city officials in Portland and now Lewiston, to make sure there's a plan in place for safe isolation as somebody gets tested positive.
Okay. Thank you. There are two questions about testing. One is, how, I think you said yesterday that I listened in, even though I wasn't there, that Maine really needs to double or triple the amount of testing that we're doing on a weekly basis. How soon will you have a detailed plan for doing that? And then secondly, you suggested, is there a testing breakthrough announcement coming this week in Maine, at least in terms of available materials and tests?
So Don asks about when we think we might be able to really truly expand our capacity, at least at the Maine CDC lab, to where it needs to be. And so Don, I definitely will answer your question, but I want to take a step back and talk about what we mean by testing. And what we mean by testing is two things. The first is the amount of capacity that exists in the state or at the state's disposal. And then the second is the number of tests that are actually being done. So capacity is what could be done, the theoretical maximum, and then the other is what's actually being done. Our capacity can be thought of in a couple different ways, but the one in which we at the state have the most direct control over is the capacity at the Maine CDC laboratory in Augusta. And so when I have talked about doubling or tripling, I am referring to the state as a whole, but most specifically referring to the capacity within the Maine CDC laboratory. Because, at least for us, that's where we can dial the knobs and pull the levers to try to get those increases into place as quickly as possible. And again, there, I'm talking about the overall capacity that we have. We have been working with an organization to try to at least double that capacity, if not go even further, to try to make sure that the Maine CDC laboratory can offer a test and conduct a test for any healthcare provider who requests it in the state. We hope that an announcement on that is coming soon, but there are, of course, a lot of moving pieces in any such deal like that. So I can't promise when we will have that, but we hope it's very soon. And rest assured, when we do have that all in place, everyone who's tuned in right now will not miss that. Don, I'm going to turn now over to Emily Tadlock over at WABI.
Hi, Dr. Shaw. Thanks so much. My question today, with things, you kind of touched on resurgence a little bit before, but with things reopening, at what point, how quickly would we know if there was a resurgence or a spike in cases? And I have another question, but I'll save that for after this.
Great. So Emily asks about what the detection time is if there were a resurgence in cases. That's something we're deeply concerned about. And for that reason, Emily, one of the ways that we look at how we know as we are progressing through any of the various stages of reopening, we've deliberately made sure we build in enough time to detect any kind of such resurgence. So the time varies, of course, and it depends on a couple of things. The first is, how long does it take someone who's been exposed to the virus to know that they've got it, usually when they develop symptoms. Then how long does it usually take them to go to the doctor? And then how long does it take them to get the test result back after they go to the doctor? And then how long does that take to get up to Maine CDC? For the first one, individuals with coronavirus who are exposed typically start developing symptoms around 5 to 6 days. But it can be as quickly as 2, and it can be all the way up to 14. From the time someone gets sick to when they go to the doctor varies, as everyone can imagine. Some people might go that day. Some people may wait a couple days. As soon as as soon as someone gets a swab, we want to make sure that the result can be returned as quickly as possible. This goes back to what I was chatting with Steve Missler about. We want there to be as little delay as possible from the time that the nasal swab is done to when the doctor's office gets the result back. Ideally, 24 hours. That's what Maine CDC's lab can do. By the time a swab is taken, doctors know how to get it to Augusta really quickly, and we can return results back ASAP. As soon as those results get returned back, we want to make sure, and Maine CDC is automatically electronically notified. So, Emily, that's a long way of saying that time period for all of that to happen can be as little as 7 or 8 days, 6 or 7, and as great as up to 23 at the very, very high end. That's why we have to look at the data every single day. But it's important to note that the data that we are looking at today are really a replay of events that were happening 7, 12, 20 days ago because of all of those other things that have to happen. And it's also why this turnaround time piece is so important. Every single day that it takes for a specimen to be shipped somewhere and for a result to be done adds another day before we know what was going on. And as we think about reopening, having that timely return of results, ideally within 24 hours, is more critical than ever. And that's one of the key factors that we are evaluating before we ask any laboratory out there to do more and more tests for us. Emily, did you have another question? I think you did.
I did. I had one more, if that's okay.
Go ahead.
So my next question would be on reporting cases for out-of-staters. As things do continue to open, summer comes along, lots of people are going to be traveling into the state. Yes, they're supposed to quarantine for 14 days. What are we going to be doing in terms of reporting cases? Are we going to be keeping these out-of-state numbers separate? Are they going to be part of Maine's numbers? I don't know what it's going to look like. I'm sure you don't either, but how are we going to be reporting this?
So Emily asks about reporting cases for out-of-state individuals. And there, Emily, we will follow the same protocols that every other state follows, which is to say we will continue the practice. If an individual who enters Maine happens to get diagnosed with coronavirus during the short time period they might be in Maine, their state of residence will be the one reporting that. Similarly, if a Maine person happens to travel to Arizona and gets diagnosed with coronavirus and returns to Maine thereafter, those numbers will be on Maine's numbers. That's the way that the system works, not just for coronavirus, but for a number of other viruses, in fact, every other infectious disease. But Emily, it is a good time to remind folks that individuals right now who are coming to Maine should not think, as the governor has noted, should not think that they can do so as a way to escape coronavirus. Our expectation remains that any individual who is coming to Maine from out of state be prepared to quarantine for a full 14 days following their arrival. To the extent that they followed that, the scenario that you described, Emily, is not one that should materialize. We will turn next to TJ Tremble over at ABC 7.
Good afternoon, sir. My question deals with the quarantining of people coming into the state. How exactly will that be carried out?
TJ, tell me exactly what you mean by that.
Well, somebody comes, your aunt or uncle from Michigan comes to visit you. You, being the nice person that you are, say, you can't go out of our house for 14 days. But somebody else's aunt and uncle from Florida comes to visit them, and they say, let's go to camp and let's go to out to dinner and forget the 14. How is that going to be enforced?
Well, I would defer enforcement questions over to our colleagues elsewhere, perhaps in public safety, and we'll try to get you a better sense of that. But again, our expectation is that anybody who enters the state, per the governor's executive order, would need to quarantine. Now, enforcing any such order, of course, is always a challenge. There's no question about that. But make no mistake, it is an enforceable order by the governor herself. So if it were to be the case that an individual were detected, it would be up to law enforcement to determine how they would wish to enforce that. But it is an executive order, and thus it is enforceable.
One other question.
Sure.
I could. Mm-hmm. You're probably well aware that in the three states that make up the northern district of the U.S. Postal Service, they've discovered 5 cases of COVID among Postal Service employees. Is that considered an outbreak, or is it just an anomaly?
Well, it's certainly not an anomaly. I'm not going to characterize it that way at all. An outbreak really requires not just an uptick in cases, but an outbreak, the essence of an outbreak is an epidemiological link among the cases. If those 5 individuals all worked in the same room, sorting the mail together, and were exposed to one another for a prolonged period of time, that would be grounds for us thinking about it more as an outbreak. But it really does depend on that epidemiological link among the in this case, 5 individuals. If there's no epidemiological link, it could be just the case that a number of individuals with the same job happen to all also have coronavirus. Similarly with, say, healthcare workers. There might be institutions in the state where a number of healthcare workers have coronavirus, but they're not necessarily linked. So it's that epidemiological link that really defines an outbreak. And until an investigation is completed, we don't really know whether it's an outbreak or whether it's individuals who happen to be detected at the same time who happen to have the same disease.
One final thing is, are you investigating at this point the Medway Post Office cases?
So we investigate any case of coronavirus, and we conduct the same degree of contact tracing. I won't comment on specific individual workplaces for privacy reasons, but we investigate every single case of coronavirus in the state.
Thank you, sir.
Yep. We're going to turn now to Dan Newman over at the Maine Beacon.
Hello, Dr. Shaw. I was just wondering if you could talk a little bit about how the state made the decision to allow the opening of hair salons and not like similar services such as like nail and massage parlors that also require sustained physical proximity. Could you just describe the process of selecting which industries to open and when?
Sure. So Dan asks about the way in which the Department of, or DECD has gone about selecting industries that would be coming up for reopening. Dan, I think Commissioner Johnson would probably be better able to shed light on that process. We'll refer your question over to her to make sure you get a better glimpse into what that process entails. But what I will say is that one of the criteria that we look at, or that in general is looked at, is to what extent are the individuals within any particular field able to open up in a manner that if they follow everything on the checklist, they would be able to open up in a manner that would be consistent with and protective of public health. Individuals who work in hair salons, for example, are used to working in situations where hygiene is at a premium. And so that was part of the discussion. But again, Commissioner Johnson would be much better able to provide much more detail on the process and the communications that she and her team have had with members of those communities in different sectors. We will turn now over to Brad Rogers at WGME.
Hey, thanks, Dr. Shaw. Has there been any recommendation or discussions on closing the Tyson plant? And, if not, will employees be retested before they go back to work just to ensure that, no one's bringing coronavirus back into the plant?
So, Brad, the plant is idled, and it's been idled since Friday or Saturday, I believe. And that was a decision that Maine CDC recommended and Tyson operators were in agreement with. And the plant remains idled, and they intend to continue idling it until Thursday. In addition to that, every single individual who works there or was a contractor who had visited has been offered testing. And so it's only those individuals who are negative who will be allowed to return back. Those who have been positive will be placed in isolation.
Okay, thanks. Oh, go ahead. I'm sorry.
No, go ahead.
I want another quick question, if you don't mind.
Sure.
It doesn't seem like local law enforcement is getting involved. Do you think they should? And if not, is there something the public should do? I mean, should the public, call the police, or what should they do? If they see some people violate them?
To call the police on Tyson Foods?
No. I'm sorry. Not on Tyson.
I figured you were talking about individuals with quarantine. Yeah.
On individuals not wearing masks or maintaining a safe distance, things like that. It doesn't seem like the police are getting involved in this.
Yep. I'm going to, that it's a fair question, Brad, and I think I'll probably ask our colleagues in law enforcement and public safety to weigh in on how they view enforcement of any one of those orders. And so we'll probably refer that question over to our colleagues in law enforcement to get their take on how they're looking at this. We will turn now to Megan over at WMTW.
Thank you, Dr. Shaw. My question is also about the Tyson plant. You mentioned that there were about 30 or so contractors that were offered testing. Those tests are outstanding. We're still waiting to see the results of those. Is there any way, or do you know the contact they had with the full-time employees, and are you expecting high numbers of positives to come back from those contractors' tests? Meaning, can you give us some insight into how closely they worked? Do you know that information?
So Megan asks about individuals who may have been in and out of the Tyson facility and what we know about their degree of interaction. And Megan, usually in these situations, we defer questions of that nature over to the Tyson operators themselves. They would know in much greater detail how much contact any particular visitor to the plant had with other employees. Maine CDC doesn't have insight into that. If any of the cases were positive, we would, of course, conduct our standard contact tracing investigation. But before we have those results, management and operators over at the Tyson facility would really have a better sense of how any particular visitor or contractor, what degree of interaction they had. I'm going to turn things over to Dustin over at New England Cable News.
Thanks, Dr. Shaw. Oops, trying to log my other interview at the same time as talking to you. My question is, what's the latest conversation on the 14-day quarantine as the summer goes on? Are you expecting it to stay in place? Is there any still conversation about adapting it in certain cases so that the maximum amount of healthy tourists can move about? Where is that conversation at this point?
So Dustin asks about where things stand with any plans around the summer as it relates to the 14-day period. And right now, Dustin, the 14-day period stands. But our planning overall is dependent on what the epidemiology tells us. When I say that we're data-driven, that's what I refer to. I refer to the fact that as the data change, so might the policies that are attendant to it. So right now, we're evaluating every single one of our policies that's in place. The 14-day quarantine, our approach to universal testing in light of the possibility for false negatives, all sorts of things are always under investigation and always under review based on the day-to-day changes in the data. The 14-day quarantine requirement is no exception to that. If the data change, if we see case counts change in some meaningful way, if there are breakthroughs in terms of testing on the rapid front, if there are any of those things that happen, we might reevaluate how we implement or how we would go about thinking about the 14-day quarantine requirement. That's just the nature of public health. We're always trying to figure out where the data stand. So each and every one of these policies from a public health perspective is always under constant reevaluation. At this time it stands, but again, much can change based on how the dynamics of the disease change here in Maine, as well as how the dynamics of the disease change elsewhere. We're also learning more and more and more about the nature of transmission itself. Just in the past few days, there have been a number of papers that have been published that are trying to get a much better grip on how much coronavirus can spread from one person to another, when that spread occurs, in what conditions it most occurs, and to whom it might most occur. And that's just been data that have come out in the past few days. So as those data come out and we get a better handle on how coronavirus spreads, we'll certainly be reevaluating every one of our public health policies. So with that, those are all the questions for today. Thank you all for tuning in. We look forward to catching up tomorrow. Thank you very much.
Hello everyone, Cindy Williams at News Center Maine. You've been listening to the daily Maine CDC update on the COVID-19 situation. You were just hearing from Dr. Nirav Shah, the director of the Maine CDC. They updated the numbers today. COVID-19 cases up to 1,226. That is up 21 from yesterday. And there are 1,150 confirmed positive cases. There have been 4 new deaths since yesterday. That brings the total to 61. Much of the questioning today really focused on the Tyson chicken processing plant in the city of Portland, where there has been an outbreak. They say they are doing universal testing now after discovering that 12 people were positive for COVID-19. That new testing has turned up a total of 25 new cases, so a total of 37 at the plant right now. But that universal testing is continuing, those results continuing to come back. Dr. Shah said that Tyson has idled the plant. It's been idled since last week and will be idled for several more days until Thursday. They want to have all of those tests back before they decide to reopen the plant, as only those who have tested negative to coronavirus will be allowed to come back to work. We're going to have a bigger wrap up of what was said at today's conference coming up tonight on News Center Maine. We'll see you then.